look at the airway first. I'm doing jaw thrust and chin lift maneuver, sir. Do I see anything in the mouth?
Some secretions are there.
What is the monitor telling me, sir?
You are going to try monitor right now.
Please try the monitor.
What do you want to know in the monitor?
So we need to know the saturation.
Saturation is 82%.
Okay, right. And did this suction help in the saturation improvement?
No,
sir?
not at all.
Not at all. Okay. So anyway, sister, please get me the intubation ready. And I think I need to secure an airway for him. And before that, you take the instruments here. I'm going to open the collar. Can you please stabilize the neck?
Yes.
Please do. Please do. Please do stabilize the neck. Right? So, right. Sir, I've got my laryngoscope. I'm going. Can I see the vocal cords?
You are
sir?
not able to see the vocal cord because of color is on.
Oh.
Patient is having 70% now.
Okay. Okay. Right. Can you stabilize this now? Okay. Okay. Right. Now, sir, can I see the vocal cords?
What you have done right?
I am just putting the laryngoscope there, and I have done the suction. And can I see this thing
So
now?
can you deviate the tongue?
Yes, I can deviate the tongue, and I have deviated the tongue.
Okay.
Can I see the vocal cords now, sir?
Yeah,
Should I
you
have
can-
it to burp?
You can see the vocal cord.
Okay, right. And I am now going inside with the tube, and I'm through the tube, sir. And now I'm inflating the tube, and I've connected it to the air and back. Okay. Can you put the collar back on? I'm stabilizing the neck. Sir, can you tell me the saturation, please, now?
Saturation is 88%.
Right. Can you keep back masking this? Can you keep back masking this? I keep the bag mask. Can you put another IV line there and take the blood samples and send it to the lab?
Patient is having shallow respiration.
Oh. Right. Have you signed it? You have sent it. All right. Okay. Can you have the bag mask? I'll go ahead and see the breathing part. Right. So holding the bag mask. Sir, I am exposing the chest. What do I see in the chest?
You are seeing the bruises on the left side of the chest.
Okay. Do I see the chest rise symmetrically, sir?
Chest rise is a little bit less on the left side. On the right side, it is moving well.
When I push the bruise, does it
Our
respond,
patient is
sir?
breathing.
Okay. On auscultation, sir, what do I find?
Bilateral normal breath sounds are
Normal
present.
breath sounds are there. So what is the saturation now, sir?
What anything else you want to know in the auscultation? Apart from breath sounds?
Any other adventitious sounds I am hearing, sir?
In the lungs?
Yes.
Of course, no.
Okay. And in the heart, sir?
Heart sounds are normal.
Heart sounds are normal, sir. Can I know the saturation now?
Saturation after bag mask ventilation is 94%.
Okay, sir. And is there anything shown in the neck, sir?
I do not know, you have not asked me
Any
before when you are doing collar. The patient is having saturation 60% now after doing the collar down support.
Okay. So what is the neck showing, sir?
What do you want to know?
Is there any distended neck veins?
No, there is no.
Is there any tracheal deviation,
No,
sir?
there is no deviation.
Okay. So what is the saturation?
I think
sir?
come on this side so that they can see from this side. Yeah, look at the side.
And what is the saturation now, sir?
Saturation with bag mask ventilation and then on is 94%.
So what is the BP like, sir? I have already put in another cannula. Sister has put in another
How much
cannula.
fluid you have given?
Sir, 500 ml of fluid has gone. Or distilled fluid has gone.
Okay, the BP is 90 by 50 now.
90 by 50 now, sir. Okay. Sister, continue the bag mask, but tell me to get me the fast machine.
Fast has come.
Okay. Sir, what is the epigastric window showing, sir?
Normal.
Okay. What is the splenorenal showing, sir?
Normal.
What is the hepatorenal showing,
Normal.
sir? Okay. What is the suprapubic showing, sir?
Normal. You can see the past pictures they have come here.
Okay.
Yes,
That is showing, okay. So this is the hepatorenal, sir. This is showing normal. There is no fluid out there. I presume there is nothing in the abdomen. What about the pelvis, sir? Do I see any echinosis, bruises on the
You have ordered for the pelvic X-ray and the chest X-ray?
Yes, sir.
Okay, so you see the pelvic X-ray?
Right. So pelvic X-ray seems fine, sir. And now I will go ahead to the.
And this is the chest X-ray?
Oh, so I think in the chest X-ray what I can see is an enlarged mediastinum, a widened mediastinum. Otherwise the lungs is clear. And I think my tube is in the right right position as per this X-ray. So I anticipate, sir, that with the widening medial sternum with the bruises on the chest might convey to me something which might need a referral outside.
Okay.
So in the meantime, sir, anything, the pelvic compression test is fine?
Yeah, pelvic, there is normal.
Normal, okay, sir. Sir, I'm going to put in.
Did you examine the abdomen clinically?
Yes, abdomen seems soft, sir.
Yeah, we saw.
Okay. And the ball sounds are present,
All
sir.
sounds are present.
Okay. Sir, what about the perineum, sir?
Perineum is okay. There is no bruising.
I'm putting the police catheter inside. What do I find, sir?
You find 200 ml of clear urine.
Here. Okay. Okay, sir. Now I'm going on to the limbs. And what do I find in the limbs, sir? I can see a splint applied there. Can I see any obvious?
There is no bleeding.
There is no bleeding there. Can I feel the peripheral pulse, sir?
Yes,
Here?
you can feel the perineum.
Okay, sir. Okay. Sir, now what I think is that I will put the orogastric tube as well, sir.
Okay, why orogastric?
So I don't want to put it in through the nasogastric region because I'm suspecting some head injury.
Okay.
And which I can see that there is bleeding from the nose.
Yeah.
There seems to be bleeding from the ear as well.
Okay.
And a little bruising at the back of the ear as well.
Okay,
So I
okay.
put the orogastric tube, sir.
Okay.
What does it show me?
100 ml of mucoid fluid and digestive material.
Okay, sir. Right. So I think now what do I find the vital signs, sir?
What vital signs you want to know?
Sir, BP, pulse,
Blood pressure after giving 500 ml of warm distilled solution is 94/70.
right?
Yes, what else?
What is the saturation, sir?
Saturation is 94% after that in mass calculation.
Right, sir.
What else?
What is the ABG showing, sir? I said it.
ABG is report is awaited.
Okay.
What else is the vitals you want to know?
That's fine, sir. So it seems we
The
are good
respiratory rate is now 20 per minute.
So I think respiration is better. The saturation has improved a little, and I think I've already sent the blood. So I'll cross match and keep the blood also. Not started as yet right now. And now I will go on to my secondary survey with a line about the.
Would you like to examine the GCS of this patient?
Yes, I would like to see the GCS of this patient also. So can I see any pupillary reaction, sir?
Pupillary bilateral equal and reacting.
Right, sir. Bilateral equal and reactive, sir. Any dilatation of the pupil? Or the
No,
pupil
there is
normal
normal size.
size? They are normal size. Is he now responding anything? If I press the bruise here, is he showing any response?
You want me to tell about the E, B or M?
Sir, E I have already, yes, you can't tell about the V because he's already intubated, sir. I
Intubated.
need to know the E and the M.
So patient is
press
opening
here?
eyes to pressure.
Right. And is he moving his limbs or
Patient
relieving my
can
hand?
localize the pain.
Patient can localize the pain. So, and of course the voice we cannot
Yes.
estimate, right? So now I'm first going to have a conversation with
So
reference center.
what GCS would you like to
So-
comment upon?
I think the GCS is 7.
7, yes.
The GCS is 7, sir. And I would like to, based on the X-ray findings.
And since GCS is 7 and the patient's vitals are more or less stable, anything else you want to know?
Sir, I will try to ring the person whom I want to transfer because what I am suspecting is two things. One, definitely there seems to be some head injury there, which needs to be taken care of by the neurosurgeon. And secondly, the X-ray shows me that there's a crowded mediastinum, so there may be something there also as well. Some thoracic aorta or something is there, there's a trauma. So I need a CTPS. So I will talk to these people first, and by the time the ambulance comes or if I have time.
So your doctor is available.
Okay. Hello, sir.
Hello.
Yes, sir. This is Dr. Amitabh from the Peripheral Health Center. Am I talking to Dr. Vinod from
Yes,
ICIMS?
good morning, Dr. Amitabh.
Okay, sir. So we have a patient, sir, here who is a 22-year-old and he has fallen from a building which was about 10 meters high. While he was falling, his helmet came off and we got the injuries as a leg swollen and asymmetrical, the left thigh particularly. His vitals were totally unstable when he came to us. The saturation was 84, he was hypotensive, he was tachycardic, and he was hypothermic as well. So now when we got into the hospital, we have put in a definitive airway for him. The neck collar is still applied, neck doesn't show anything. And what the splint was already applied, we have kept it applied there, the peripheral pulses are there. The fast reports are negative. And now the vitals are stabilized. The X-ray shows the trachea, the tube is well put and it is in the proper place. But at the same time, what we are getting and why we want to refer to you are two reasons. Because GCS being low, and we have obvious signs of some basal skull injury in the form of bleeding from the nose and from the ears, as well as a battle sign.
Okay.
The second thing that we are noting why we require help is a broadened medial sternum, so we might require a CTVS if you have there, and we would like to transfer for these two reasons.
Okay. So you can send. Do you have ambulance with you?
No, can you send me the ambulance, sir?
Okay, I am arranging ambulance.
Right.
It will take 15 minutes to reach.
Right.
But unfortunately, I do not have any paramedical staff in that ambulance.
Right. So I think myself will come or my sister will come with the patient, because we have the endotracheal tube in place. I don't want it to get dislodged. I don't want the IV to get dislodged, and we will take a blood with us in case the vitals destabilize.
So ambulance will reach your place at in 10 minutes.
All right, sir. So I am going to do the secondary survey in that time. So again, now what I am
And your one attendant is already available now.
Okay, right. So can you just document my findings? So what I am.
Yeah, he is attendant to the patient.
Oh, all right. So can you.